morning, October 23rd, 2025. I'm Dr. Deuk Majin, CEO and founder of the Deuk Spine Institute. You are watching a live stream of spine surgery being performed. The most common reason people need spine surgery is a disc problem, whether it's causing pain or stenosis, narrowing, and symptomatic with radicular symptoms or claudication. But this patient had a spinal fusion done elsewhere. He travels here from Chicago, Illinois. He's coming to Florida because he's having horrific pain above and below his spinal fusion. Now, I didn't do his fusion. I don't recommend fusions. But they went in the front of his neck and did an ACDF 3-level, and then they went in the back of his neck as well and did a procedure. So he's had a front-back procedure. Now, the only reason in my mind to do a front-back fusion is if you're trying to pay off some bills as a surgeon and you need some extra cash, you would put a patient through a front-back procedure. I never put patients through front backs. I just either go through the front or I go through the back. But this guy had both, front and back. And it saddens me to see patients who basically I think are mistreated by their surgeons. But we're going to try our very best to help him by going above his fusion and destroying the pain nerve above the fusion. You can see C2 there. Jordan will show it to you. That's C2. You can see the odontoid. Yep, right there. And I have to go up above his fusion and destroy the pain nerve at C2-3. Shot. Right, basically right where my thing is. Go ahead. So we're going to fix pain coming from FACET joints at the top of his fusion and the bottom of his fusion. The way we do that is we use a procedure called the Deuk plasma rhizotomy. So we're going to fix 4 areas: top right, top left, bottom right, bottom left. If you have questions, feel free to ask. I'm going to go ahead and get started. Henry, let's show the audience the 30 different causes of neck pain. Shot. I'm Dr. Deuk Majin, CEO and founder of the Deuk Spine Institute. We're going to talk about the 30 causes of chronic neck pain. Chronic neck pain is neck pain that lasts longer than 6 weeks. There are 30 causes to chronic neck pain. The most common cause is the disc. There are 6 discs in the neck. These discs can become injured. The first disc is C2-3. Next is C3-4, C4-5, C5-6, C6-7, and C7-T1. The most common disc to be injured and cause neck pain is C5-6, followed by C6-7, followed by C4-5. The other discs rarely cause pain. Discogenic pain represents 85% of chronic neck pain. Next, the facet joints cause 10% of chronic neck pain. Facet joint pain is very common in patients with neck injuries and spine injuries. Facet joint pain is usually located on the sides of the spine, either right, left, or both. Facet joint pain gets worse with rotation of your head and neck, worse with extension. The most common facet joints to be injured are C5-6, C6-7, and C4-5. C7-T1 is another common facet joint to be injured. These joints, after injury to the capsule, will develop arthritis. It is the arthritis in and around the facet joint that causes the neck pain and stiffness with movement. Deuk plasma rhizotomy is the best treatment in the world available for painful facet joints. Deuk laser disc repair is the best treatment in the world available for painful discs. Other causes of chronic neck pain include fractures, tumors, infections, and muscle spasms. These other causes represent less than 1% of chronic neck pain. Thank you for joining us for 30 causes of chronic neck pain. Okay. Welcome back. You can see from our video there are 30 things, structures, that are responsible for basically all of the neck pain that patients experience that is chronic neck pain or neck pain that lasts more than a few weeks. And the most common of all is the disc. When you have disc pain, it's usually deep in your neck, in the center, and it hurts pretty much all the time. And there's no cure for it except to operate on the disc to fix the source of pain at the level of the disc. Now this patient has the second most common cause of pain in the neck, called FACET joint pain. That's FACET joint pain. You guys saw that on the video, that there are FACET joints in the neck, and his pain is definitely originating from the FACET joints above and below his fusion. You can see the fusion right there, and you can see my probe treating the FACET pain. Henry, let's show the audience the FACET pain and how we treat it here at Deuk Spine. This is what this patient is being treated for right now.
Facet joint injury is a common cause of chronic neck pain. The inflamed facet capsule tear generates pain signals. The best treatment for facet joint pain is the Deuk plasma rhizotomy. The inflamed facet joint pain nerves are destroyed. The advantages with the Deuk plasma rhizotomy is that it's an outpatient procedure that takes 30 minutes to complete, very minimal bleeding and pain after the surgery with immediate recovery and return to work the next day, as well as a 99% success rate and permanent pain relief with a single treatment. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-NECK 349-6963.
Yeah. All right, welcome back. You can see from our video that facet pain is caused from injury to the facet joint from trauma. Trauma is the cause of pretty much all problems that people have with chronic pain in their spine, whether it's trauma to the disc causing a disc injury or trauma to the facet causing a facet joint injury. In the case of this patient, show us the facet joint at the bottom of the fusion. You guys see the fusion. Show us the fusion. There's screws. There's a metal plate holding his spine stiff. Now, because that whole section of his spine is stiff, there's no movement there. All the movement is happening below and above. So look at that joint right there. Jordan just highlighted. That is the facet joint. The white line is the joint. The darker bone above is sclerotic end plate of a joint, and then the sclerotic bone below, that's C7. So we're going to go and destroy the pain nerve right there to that joint, because that joint is where his pain's coming from. All right, and we have a question.
Question coming from Lanu on YouTube.
Hi, Lanu, welcome.
Asking, insurance question, many people have stopped participating in their insurance. They went overseas to have surgeries and paid cash. They said it's much cheaper and quality of service. What's your view on this?
It's called medical tourism, and when people aren't stopping to participate with their insurance, they're actually still paying the insurance premium every month. But what happens when the doctor says you need surgery, like knee replacement, then the insurance company makes the patient pay so much money out of their pocket. Okay, so much money have to be paid as what's called the copay or co-insurance or deductible. That's how they get you. So they pretend that they're going to cover, the insurance pretends they're going to cover your surgery, and you're paying them every month in case you need surgery. And then when you actually need the surgery, they say we're going to cover it, but first you have to pay your patient responsibility, your patient money that you have to pay according to our contract with you, the patient. That's the insurance contract. They make it very complicated. But the amount that the patient has to pay is called their out-of-pocket or patient responsibility. And the patient responsibility for a knee replacement, for example, could be $12,000, could be $20,000 shot. So when patients are faced with, hey, I have to pay, shot, $20,000 for my knee replacement, right there, shot, then they're saying, okay, well, instead of paying $20,000 for my knee replacement, I'm going to go to Thailand and have my knee replaced for $8,000, right? And the trip to Thailand may cost them $2,000 or $3,000. So in the end, they're saving a few $1,000s. So this is called medical tourism. They're not leaving America and going to Thailand because Thailand has better surgeons. They're leaving America because the insurance company is forcing them to make a financial decision to basically keep their $20,000 and not spend it on their knee replacement. But here's the thing. People should never have to spend that kind of money on their medical care. That surgery used to be covered by insurance and still should. And more importantly, the insurance companies are making billions of dollars in profit from taking people's money and not paying for their medical care. It has to end. The American people have to wise up. They're being robbed by the insurance industry. They have to stop paying these high premiums and getting nothing in return. That's what needs to really happen. Same thing happens with Deuk laser disc repair. Okay? They tell the patient, oh, we don't cover that. You're going to have to pay out of pocket. Why should the patient pay out of pocket? Patient shouldn't pay out of pocket for something that should be covered by the insurance, but when the insurance companies get to pick and choose what they want to cover, they're going to cover as little as they can. They're going to choose to cover very little. And then, of course, when they do cover something, they're going to tell you, you have a copay. You have to pay out of pocket. Yes, we're covering the surgery, but you're going to have to pay $10,000, $15,000, $20,000 out of your pocket for that surgery. Now, the real reason why the insurance company wants the patient to pay $20,000 for knee replacement surgery is because, number one, when the patient has to pay $20,000, they a lot of times will choose not to have surgery. They'll just live in pain the rest of their life. That's wrong, morally wrong, ethically wrong. Insurance companies should not be allowed to do that to patients. Okay? Shot? We shouldn't be allowing them to do that to patients. We must stand up to them and say, this is wrong, Shot. You should be covering this procedure, insurance company. We're done.
Sitting down, please. Thank you.
We just went in and burned the pain nerves, cut them, destroyed them. It's a painful surgery that we do here. This is one of the most painful surgeries I do in the neck. Patients tend to have some discomfort after this procedure for about a week or two on average. Other patients shorter, other patients longer. But I just went in and destroyed the pain nerves to the joints on both sides above and below his prior fusion. Can't see it here, but he's got a big scar in the back of his neck from his prior surgery. All right, Henry, any other questions?
Yes, we have a comment coming from Bashar on YouTube. Saying, I am one of your Syrian neurosurgeon fans, and each time I feel frustrated of my specialty, I escape to your live streams and procedures and feel excited again and hopeful again.
Dr. Bashar, thank you so much for your kind words. They mean a lot to me, and I appreciate the fact you come and keep me company in the operating room and assist me there. It's a pleasure to have you. And I hope you have a very successful career. And if I come to Saudi Arabia someday, I would love to meet you in person and talk to you and get to know you. All right, thanks for joining us. We're done with this part of the surgery. We'll be back next. I'm going to try to do a endoscopic disc repair at C6-7 below the fusion through the front of his neck. We're going to flip the patient over, prep and drape, so we'll be back shortly, okay? I'm very concerned because he has a thick muscular neck. He has a lot of scar tissue from the prior surgery, ACDF on the right side. I'll attempt to go on the left side, opposite of where they went before. But we'll see. Hopefully I can get it done. I told him there's about a 20% chance I won't be able to do the surgery, and that's a real 20%. So please join us in about 15 minutes. Thank you.